Welcome to the Deep Dive. Today we're tackling a topic that, well, a lot of you have brought up: the world of canine fears, phobias, and anxieties. It can be pretty baffling sometimes.
It really can.
And you've told us you're worried about your dogs, so our mission here isn't just to, describe what a scared dog looks like. We want to dig into what's actually happening under the hood.
Exactly. The why and the how behind those reactions.
And most importantly, what practical steps we can take to help them.
Right. We know you want real insights, actionable stuff, without getting bogged down in jargon. So we've gone through the material to pull out the key information in a clear way.
Perfect. So let's start with the fundamentals. What are we actually talking about when we use these terms? Our sources lay out three key ideas. First up, fear.
Okay. Fear is that immediate response, both psychological and physical, to a danger that's right there happening now.
Like a dog running at them, barking aggressively?
Exactly. A present, real threat. It makes them want to avoid it, get away. That's fear.
Then there's phobia. How's that different?
Well, a phobia is still a fear response, but it's marked, excessive, and often kind of irrational compared to the actual danger. The reaction is just way bigger than it maybe should be.
Okay.
Yeah.
Like the classic example you hear about all the time.
Thunderstorms, fireworks, yeah,
Oh,
those are the big ones for noise phobias. The dog might be completely safe inside, but they're terrified.
Got it. And the third one is anxiety. This one feels a bit fuzzier.
It can be. Anxiety is also a physical and mental reaction, but it's triggered by anticipating something bad, maybe based on past experiences or just a general sense of unease about the future.
So the scary thing doesn't even have to be present for the dog to feel anxious.
That's the key difference. The worry is almost internal. It's anticipation or memory driving it, not an immediate present danger.
Okay, that clears things up. Fear is now, phobia is an overreaction to something specific. Anxiety is worry about what might happen.
Pretty much sums it up. Now, should we dive into what's happening inside the dog's body when that fear response actually kicks in?
Yes, definitely. The sources describe this fascinating chain reaction in the brain. It starts when the dog senses danger.
Right. That sensory info site, sound, smell travels really fast to a part of the brain called the amygdala, specifically the central nucleus of the amygdala.
And the amygdala is like the brain's fear center.
Sort of the main alarm hub, yeah. It gets the danger signal.
And then it sends out its own signals.
It does. It tells the central gray matter to get the muscles ready. That's the freeze or flight response kicking in.
Okay.
It signals the lateral hypothalamus, which activates the autonomic nervous system. Think adrenaline, heart racing, that whole fight or flight surge.
Right, the classic stress response.
And it also signals something called the stria terminalis, which triggers the release of stress hormones like cortisol from the adrenal glands.
Wow. So it's a whole body physiological response designed for survival.
Exactly, a full-on stress response.
And how intense that reaction is.
Yeah.
It's not just about the scary thing itself, is it?
No, it's influenced by other factors. Like, does the dog feel they have any control? Do they have ways they've learned to cope? How overwhelming does the situation feel to them?
And this is where learning comes in, too. The sources mentioned classical conditioning.
Oh, absolutely. Classical conditioning is huge here. It's how something totally neutral.
Like a flashing light.
Right. Or maybe the sound of keys jingling, if that always precedes the owner leaving. That neutral thing can become associated with a stressful event.
So eventually, just the keys jingling triggers the fear or anxiety.
Exactly. The dog learns the association. The neutral stimulus becomes a trigger itself.
And those stress hormones we mentioned, cortisol and adrenaline, they don't just cause the immediate reaction.
No, they actually help solidify those fear memories. They make the learning stronger, unfortunately.
So the sources suggest that while we can reduce the fear response, those original scary memories might stick around.
It seems that way. They might not be completely erased, which is why some fears can be so persistent. It's an important point for management.
Definitely. Okay, so we understand the internal process a bit better. What about what we actually see? What are the outward signs when a dog is experiencing fear, phobia, or anxiety?
There's a really wide range of effects across different body systems. Let's start with behavior, which is often the most obvious.
Okay.
You might see immobility, the dog just freezes. Or the opposite, restlessness, constant pacing, maybe circling.
I've seen that pacing. What else?
Hyperattachment, becoming super clingy to the owner, trying to escape, obviously, or avoiding certain places or situations. Defensiveness can crop up too.
And sometimes
Destruction.
Yes. Destructiveness, excessive vocalizing, barking, whining, howling, and unfortunately, sometimes it can manifest as aggression, usually defensive.
That's a lot just on the behavioral side. What about physically?
Well, their heart rate increases, that's tachycardia. Internally, there are changes in the HPA axis, that stress hormone system we talked about, and blood glucose can go up.
Does it affect our digestion? It definitely can. Loss of appetite and appetence, sometimes excessive drooling, which is hypersalivation, even vomiting or diarrhea or needing to urinate or defecate suddenly.
Wow, it really impacts everything.
It does. The source even mentions effects on their blood counts, something called a stress leukogram. Potential for self-injury from panic or anxiety.
Hmm.
Neurologically, besides the restlessness, you might see trembling, they might seem less sensitive to pain, or in extreme cases, even catatonia, like being completely shut down.
And you can see it in their eyes, right?
Yes, the whites of the eyes might look redder. That's a piscloral injection. And their pupils often dilate, get much larger mydriasis.
Breathing changes too.
Rapid breathing, tachypnea, and even their skin isn't immune. They could injure themselves trying to escape or develop acrylic dermatitis, that compulsive licking, often on the legs or paws, driven by anxiety.
It's just such a profound system-wide impact.
Absolutely. It really underscores that this isn't just in their head. It's a deep physiological and psychological experience.
So given all these effects, what makes some dogs more likely to develop these problems? What are the underlying causes?
It's usually not just one thing. The sources point to a combination. Genetics definitely seems to play a part.
So some dogs are just born more prone to it.
It looks that way. Heredity is involved, though figuring out exactly which genes influence which specific fears is still, ongoing research.
Okay. Besides genes, what else contributes?
A huge factor is inadequate socialization, especially during that critical puppy period.
You mean not getting exposed to enough new things gently?
Exactly. If they don't learn that new sights, sounds, people, other dogs are generally okay during that window, roughly up to 12 or 16 weeks, they can become more fearful later on.
Makes sense. What else?
Experiencing traumatic events is a big one, obviously, and those learned associations we talked about, classical conditioning. Also, sometimes underlying medical issues can play a role.
Also.
If a dog is dealing with chronic pain or an illness, that can lower their threshold for anxiety and make them more susceptible to developing fears or phobias. Cognitive dysfunction syndrome in older dogs, kind of like dementia, can also cause increased anxiety.
Okay, so a mix of nature and nurture plus health status. Are there specific risk factors that make it more likely?
Yes, the sources identify a few key things. If a dog already has some fears or anxieties, they're more likely to develop others. It can snowball.
Right.
That lack of early socialization is a major risk factor. The stress of being rehomed can also increase vulnerability.
That makes sense.
Any others? Interestingly, having a mother who is anxious, fearful, or physically unwell during pregnancy or nursing might also increase a puppy's risk. And of course, going through scary experiences, especially if they're alone without support.
Okay, so if you suspect your dog is dealing with this, how do you figure out what's really going on? How is it diagnosed?
Well, the first crucial step is ruling other things out, what vets call differential diagnosis.
Meaning things that look like fear or anxiety but aren't.
Exactly. The source gives examples. On the behavioral side, maybe it's not anxiety, maybe it's just unruly behavior because they haven't been trained, or incomplete house training leading to accidents or marking behavior.
Or even just boredom.
Yes, attention-seeking or boredom can sometimes be mistaken for anxiety.
And medically.
Yeah.
What needs to be ruled out?
Yeah, quite a few things. The source lists conditions like neoplasia tumors, especially brain tumors, endocrine diseases like liver issues, Cushing's, Addison's, thyroid problems,
Wow, yes.
urinary tract infections, kidney disease, gastrointestinal problems, neurological issues like seizures, painful skin conditions, even exposure to toxins. It really shows why a vet visit is essential.
Absolutely. So do standard tests usually show anything?
Often in cases of pure fear or anxiety, basic blood work and urinalysis will be normal, but they're still vital to run before starting any medication, just to rule out those underlying medical causes.
Makes sense.
Depending on the specific case, the vet might recommend more tests, like checking adrenal or thyroid hormone levels, or maybe even imaging like a CT or MRI scan if a neurological issue is suspected.
And beyond the medical workup.
A really thorough behavioral history is absolutely key. That means you, the owner, providing detailed information.
Like when does it happen? What seems to trigger it? How does the dog react?
Exactly. Your observations are critical. And the source specifically mentions that video recordings can be incredibly helpful for the vet to see the behavior firsthand.
That's a great tip.
And any assessment should also screen for aggression because, as we said, fear can sometimes lead to biting.
Right.
And sometimes, if it's safe, the vet might do a very controlled, brief exposure to the suspected trigger just to observe the reaction directly.
Okay, so once you have a diagnosis, what's the approach to actually helping the dog? What does treatment involve?
The good news is most treatment happens on an outpatient basis, meaning at home with vet guidance.
But sometimes more intensive care is needed.
Yes, the source mentions situations where maybe day boarding at a specialized facility or even temporary hospitalization might be considered. That could be if the trigger is just unavoidable at home, if the dog is seriously injuring itself, if medications aren't quite working yet, or if the owner is having real difficulty implementing the plan.
Okay, but usually it's managed at home. What are the main components of a treatment plan?
It's typically multifaceted. Owner education is number one, helping you understand everything. Ensuring safety for everyone involved is paramount. Then comes behavior modification.
To actually change the dog's emotional response.
Exactly. Plus, environmental modification, changing the dog's surroundings to help them cope better and avoid triggers, and working to reduce their overall baseline level of anxiety.
And treating any medical issues first, of course.
Absolutely. If there's pain or illness contributing, that has to be addressed.
Let's talk about safety. What are the key considerations there?
A big one the source points out is don't try to physically force or even excessively comfort a dog that's hiding or clearly terrified.
Why not?
It can actually increase their fear and make them more likely to lash out defensively. Instead, try luring them out gently with high-value treats or a favorite toy.
Good advice. What about dogs that panic and try to escape?
For dogs with intense escape behavior or self-injury risk, avoiding crates during panic episodes is often recommended, as they can injure themselves badly. You also need to panic-proof the environment as much as possible. Dayboarding might be an option in severe cases while treatment takes effect.
And if there's fear-related aggression?
Owners must learn to avoid the triggering situations. Management is key, and using safety tools like head halters or basket muzzles appropriately when exposure might be unavoidable.
Okay, let's get into behavior modification. What does that look like?
Often, a first step is trigger avoidance for a period, maybe 2 to 8 weeks. Give the dog's system a break from the stress.
And during that time?
You work on teaching coping skills. Things like basic obedience cues, sit, watch me, but also specific exercises like look at that to change their focus, leave it, and relaxation protocols. Establishing a safe haven, a den area, is also crucial during this phase.
A safe spot they can retreat to.
Exactly. Somewhere they associate only with good things. Simple, structured interactions like asking for a sit before getting petted can help too. And independence exercises like giving them a food puzzle in their safe spot while you're nearby but not interacting.
And what should owners absolutely not do?
This is critical. Punishment is completely counterproductive. The source is very clear on this.
So no shock collars, prong collars, yelling, hitting.
Absolutely not. It will almost certainly make the fear and anxiety worse. It adds fear on top of fear.
So what should you do if your dog starts showing signs of fear?
The recommendation is to try and distract and redirect them onto something positive before the fear escalates too much. Engage them in a fun game, offer a really tasty treat, ask for a simple behavior they know well.
Okay. What about techniques like desensitization?
Desensitization and counterconditioning, DSCC, are often core parts of treatment, but they need to be done very carefully.
This is where you gradually expose them to the trigger.
Yes, but at a level so low it doesn't cause fear, that's desensitization. And you pair that low-level exposure with something the dog loves, like amazing treats, that's counterconditioning. The goal is to change the dog's emotional association with the trigger from negative to positive.
But you said it needs care.
Absolutely. The source stresses that it's best done under professional guidance, because if you go too fast or the intensity is too high, you can actually make the fear worse. It can backfire easily.
Right. So work with a qualified trainer or behaviorist. What about changing the environment?
That's the other big piece. Creating that safe spot is key. Managing the environment to minimize exposure to known triggers as much as possible.
Any other environmental tips?
The source cautions against over-reliance on crates for general confinement, especially if the dog dislikes them. And rotating toys can help keep things interesting and provide mental stimulation, which is part of overall enrichment.
And vet techs often help with these appointments.
Yes, they can play a really valuable role in demonstrating exercises, educating owners, and providing support during behavior consults.
What about just exercising the dog more? Does that help anxiety?
While exercise is great for general well-being and can be part of enrichment, the source indicates it's usually not a standalone solution for significant fear or anxiety disorders. It helps, but it's not the whole answer.
And owner education seems like a constant theme.
It's crucial. Understanding the dog isn't being bad or spiteful, recognizing that treatment is often long-term management, not necessarily a quick cure, and learning to spot those really subtle early signs of stress, lip licking, yawning out of context, looking away so you can intervene early.
Okay, let's shift gears slightly and talk about medication. When does that come into play?
Medication can be a really important tool, but the source is very clear. It should always be part of a comprehensive plan that includes behavior modification and environmental management.
So it's not a magic pill on its own.
Definitely not. It helps lower the dog's anxiety threshold so they're better able to learn from the behavior modification. For many dogs needing meds, it's likely a long-term thing, months, maybe years alongside that ongoing behavior work.
Can dogs ever come off medication?
If they show significant stable improvement, yes, it might be possible. But the source says weaning off should be done very gradually, reducing the dose slowly over weeks or months, always under veterinary supervision.
Are there different types of medications used?
Yes, the source outlines two main categories. There are situational medications used as needed, or PRN.
For predictable triggers, like fireworks night.
Exactly. Things like benzodiazepines, series like trazodone, or alpha-2 agonists. The key with these is giving them before the dog shows any anxiety, typically 30 to 90 minutes ahead of the event. They don't work as well if the dog is already panicked.
Okay, and the other type?
Daily medications. These are usually for more generalized anxiety or severe phobias, or when triggers are frequent or unpredictable. Things like SSRIs, fluoxetine is common, or TCAs like clomipramine.
And these take longer to work.
Yes, they need to build up in the system. It can take 4 to 6 weeks, sometimes longer, to see the full effects. Patience is needed. Vets usually start with a low dose and increase gradually.
Are there risks or precautions with these drugs?
Yes. Many are used extra label in dogs, meaning it not specifically approved for that use, so following vet instructions is critical. Caution is needed with TCAs in dogs with heart issues, and careful dosing in older pets or those with liver or kidney disease.
And side effects.
Possible side effects should always be discussed. And importantly, sometimes mood-altering drugs can, paradoxically, increase agitation or even aggression in a small number of individuals, so monitoring is essential.
What about interactions with other drugs?
That's a big concern. Your vet needs to know everything your dog takes, including supplements. Combining certain drugs, especially multiple ones that affect serotonin, can lead to a dangerous condition called serotonin syndrome. Always check drug info.
Are there non-prescription options?
Yeah.
The source mentions supplements.
Yes, it lists a few like Anxieties, L-theanine, melatonin, Zilkine derived from milk protein, same, and even a prescription diet, Royal Canin Calm. These might offer some support, often used alongside other therapies, but discuss them with your vet first.
Okay, so once a treatment plan is in place, what does ongoing care look like?
Regular follow-up is really important. The source suggests check-ins every couple of weeks initially, maybe for the first 6 to 8 weeks, to monitor progress, adjust medications if needed, and fine-tune the behavior plan.
And for dogs on daily meds?
Periodic blood work, usually a CBC, chemistry panel, urinalysis, maybe thyroid levels is recommended, often every 6 to 12 months, just to monitor for any long-term effects.
Looking ahead, what about prevention? Can we reduce the chances of these issues developing?
The source highlights those key early experiences. Proper socialization during that 8-12-week window is huge. Well-run puppy classes starting around 8 weeks.
Building that foundation of positive experiences.
Exactly. Also, establishing a structured, predictable relationship with the owner through positive reinforcement training. And if a dog does have a traumatic experience, addressing it quickly with support and positive counter-conditioning can help prevent it from becoming ingrained fear.
What happens if these issues are just ignored or only treated with meds?
The source suggests that progression is likely. The fear or anxiety often gets worse or generalizes to more situations if it's not addressed comprehensively with behavior modification and environmental management.
And the long-term outlook. Is a cure usually possible?
It really depends on many factors. The severity, the dog's individual response, the environment, how consistently the owner can implement the plan. Treatment duration varies a lot.
So it's often about management long term.
Yes. The source notes that only dogs who respond exceptionally well to behavior mod and environmental changes might be fully weaned off meds. For many, some level of ongoing management, avoiding triggers, using coping strategies, maybe staying on low-dose meds, will likely be needed throughout their life.
Okay, so wrapping this up, it's clear that canine fears, phobias, anxieties, they're really complex. There's physiology, behavior, environment, learning, all mixed together.
Absolutely. And tackling them effectively needs that comprehensive approach, behavior work, managing their world, and sometimes medication, all guided by professional help.
But truly understand what's going on inside, those mechanisms we talked about can really empower you, the listener, to be a better support system for your dog.
Definitely. It helps you see it from their perspective.
Which leads us to a final thought to leave you with. When you think about this intricate dance between genetics, environment, and learning in shaping how dogs feel, what do you think are the most crucial proactive steps we can take really early on in a puppy's life to foster that emotional resilience and maybe prevent severe fears and anxieties from taking root?
That's a great question. Something definitely worth reflecting on and maybe exploring more. How do we build confidently resilient dogs from the start?